evening. Namaskar, Savika. I, Dr. Vaibhav Pathak, welcome you all on behalf of Endocrine Society of India to this Facebook Live program. Each Saturday at 4:30 p.m. As a pub initiative by Endocrine Society of India for public awareness, we bring to you an interesting topic for your discussion and the topics which are relevant to your health. And this month, whole month of October, Endocrine Society of India has been raising awareness regarding the bone health and especially focusing on osteoporosis. And today's session, that is today's Saturday session, is the last in that series. And we'll be trying to answer all your queries, and we'll be taking up the questions from you. And today's session is regarding the common diseases which can cause osteoporosis or which can adversely affect our bone health, and how do our patients and how do public have to take initiative and take measures to have a control of those fractures or those osteoporosis. To discuss the topic with us, there are 4 expert panelists who will be joining to us from different parts of the country. And let me begin by introducing Dr. Ganesh HK sir. Sir is the Professor and Head of Department at Department of Endocrinology, AJ Institute of Medical Sciences, Mangalore. A warm welcome to you, sir. My second esteemed panelist is Dr. R. Bharat, sir. Sir is Consultant Endocrinologist at Arka Hormone Health Center, Chennai. Our third panelist for today is Dr. Swami Goswami, sir. Sir is Assistant Professor at Department of Endocrinology, NRS Medical College, Kolkata. A warm welcome to you, sir. And our last panelist who will be joining us from Kolkata as well, Dr. Partha Pratim Chakravarti, sir. Sir is Assistant Professor at Department of Endocrinology, Kolkata Medical College. A warm welcome to you, my respected panelists.
Thank you. Good evening to all of you.
Thank you. So as, sir, we are today going to have discussion regarding the bone health, and especially we are focusing on common diseases which can cause adversely and which can adversely affect our bone health. So I would begin by asking Dr. Ganesh sir to have a brief introduction about the topic and what is bone health for our public to know that what specifically is bone health. Sir, you are muted, sir.
Sorry. Thank you, Vaibhav, for including me in the discussion. So, जैसे सब लोग जानते हैं, bone is it's not a static organ, it's a dynamic organ. जैसे bone, there are a lot of functions which are going on inside the bone. When just like other organs like liver, kidney, bone is also a very active organ. So, for example, the whole hematopoiesis, जो अभी हमारा खून जो बनता है, वो that happens within the bone itself. So not only that, whole our muscles, ligaments, tendons, everything is lying above the bone. So it's a basic structure which gives a human ability to walk, everything. So for the bone health to be proper, it has to have good strength. So usually the bone strength, the accumulation of bone strength or bone density, which it happens over the years. Usually till the age of 20 years or 30 years, the maximum peak bone mass or bone mass जो बोलते हैं maximum bone mass, that happens by the age of 20 to 30 years. So the maximum the bone mass accumulation, जो peak bone mass accumulate होता है, वो that happens during adolescence. That is between 10 to 18 years. During that age, because of the various hormonal support and if we have good physical activity, good healthy lifestyle, good food content, then the people can get very good bones, and the chances of developing fractures or osteoporosis in the later life will be less. So that is the reason always it's very important to educate our patients or even our children to have healthy lifestyle, so that they will have very good physical activity, good lifestyle, good food choices, so that they will develop very good bones. So इसके बाद जो है, तो after the certain age, after age of 30 or so, then there will be only bone resorption which is happening. The accumulation will be very less. So the resorption also should not happen very fast. Then if it happens fast, that can lead to osteoporosis. In addition to that, what today's discussion topic, other diseases, various other diseases other than the bone can lead to various problems to the bone itself. Like the hormones का problem है, hypothyroidism, hyperthyroidism, Cushing syndrome, parathyroid का, there are many problems which can lead to adverse bone health. In addition to that, steroids, which are used commonly even by many doctors for various conditions, which are steroids are required, that can lead to osteoporosis. And steroids are inadvertently used by many of our patients also, and many so-called doctors also use these steroid preparations, which can adversely affect the bone health. So there are various other conditions which can adversely affect the bone health that we'll discuss today. So probably the whole idea is to know what are the conditions which can adversely affect the bone health and how we can prevent this osteoporosis in these conditions, so that we can have a better bones. Even with other conditions, we can have better bones.
थैंक यू सर. तो हमारे दर्शकों को ये समझना जरूरी है कि जैसा सर ने हमें बताया कि प्रत्येक हर एक व्यक्ति के हर एक उम्र के पड़ाव पे बोन हेल्थ ठीक रहना जरूरी है. सर ने बताया कि हमारी बोन्स जो हमें बोन इकट्ठा होता है हमारे शरीर में, जो बोन मजबूत होता है, वो लगभग 20 वर्ष की उम्र तक होता है. और उसके बाद जब हमारा उम्र 50 या 60 के ऊपर होता है तो हमारी बोन की कुछ प्रॉब्लम शुरू होती है जिसको हमें बचाना है और अपनी बीमारियों को कंट्रोल रखते हुए. Now, in continuation with that, my next question is to Dr. Swami Goswami sir. Sir, as we often hear that patients are often worried about their heart health. Yes, हमारा heart ठीक नहीं है. Some people are worried about हमारे liver function test ठीक नहीं है, liver में हमारी problem है. Some people are worried about कि हमारा diabetes ठीक नहीं है. So, sir, I would like to ask you that why and how healthy bones are as equally important as healthy heart for a healthy life.
So I think a very good evening to everyone, and a very, very important question. So why is good bone health important? So for that, I think we must first know what are the functions of the healthy bone. Dr. Ganesh has already touched on those, but I'll give you some more examples. First and foremost, I'll give you 3 important areas where good bone health is important. The bones act as support for our muscles. We know we have muscles in our hands, we have muscles in our feet, and the bones act as support for our muscles. So when we move about, the muscles attached to the bone get the support for movement. You just compare a snake's movement and how we move about. If we did not have those strong, long, robust bones, we would be slithering around, moving around like snakes. हम सांप की तरह घूमते रहते थे, हम पाँव में चल नहीं पाते थे. So good, strong support comes from the bones, one. Second is, we get protection to our internal organs from the bones. ये हमारा अंदर जो organ है उसको protect करता है. हमारा जो skull है वो brain को protect करता है. जो rib cage है heart को, lungs को protect करता है. इसलिए जब injury होता है, कोई accident होता है, और abdomen, पेट में bones नहीं है तो उसका organ ज़्यादा affected होते हैं. फिर मैं example दूंगा. If you consider a jellyfish, जो jellyfish होता है समुंदर में, उसको सोचिए, उसका कोई bones नहीं है, easily उसको injury हो सकता है. So strong bones protects the internal organs from injury. And third, the bones act as a reservoir, as a bank for 2 important minerals, calcium and phosphate. ये एक बैंक की तरह है, वहां पे कैल्शियम और फॉस्फेट करेंसी की तरह जमा रहता है. तो जब डेफिसिट होता है, when our body needs calcium, when our body needs phosphorus, bones वहां से रिलीज करता है कैल्शियम और फॉस्फोरस. And calcium and phosphorus has a number of important functions to play in our body. तो ये 3 important function काम करते हैं. तो if you do not have good bone health, you'll not have good support. You'll find it difficult to walk. You might fracture your bones. You might have pain in your bones. With minimum injury, the bones will fracture and your internal organs might get damaged. And you won't have enough calcium and phosphorus to release from the bank when you are in need of currency. So this is why we need good bone health.
Thank you, sir. So this was nicely explained by sir that yes, we need healthy bones for healthy life, and to keep bones healthy is as equally important to keep our heart healthy, or for that matter any other organ. So they do play as important role as any other organ in our body to keep ourselves healthy. So we'll be going ahead and focusing that how we can keep our bones healthy. So now coming on to the our topic per se, and with that, my next question is to Dr. Bharat sir. Sir, we daily see a lot of diseases in our clinical practice. Uh, so, what are those diseases which can affect the bones, sir?
Namaskar. So if you talk about common diseases which affects bone, for a in a general practitioner's point of view, if you ask me, most of the general practitioners, general physicians, they see diabetes and thyroid problems. So when we talk about diabetes, we always talk about the eye problem, the heart problem, the nerve problem, so many other things, because the volume of diabetes is so much. I'm taking diabetes as a first and a common disease. So इसमें diabetes में we don't talk about bone health much. Probably in the last 1 decade only, bone health is given much importance. So you can see that any chronic disease, you get a problem called inflammation. So whenever there is an inflammation, actually the bone strength also comes down because of the inflammation. Naturally, we know diabetes में inflammation बहुत ज़्यादा होता है. So and type 1 diabetes, when we take children with type 1 diabetes, we see growing children getting type 1 diabetes. In that, we will concentrate more on the sugar part and their other kidney and retinal part. But one thing which is not taken care much is the bone part, because growing children need a good bone strength, and type 1 diabetes may usually, many studies have shown that the bone mineral density is very less in type 1 diabetes. And as pointed out by Dr. Vaibhav and Dr. Ganesh, it's a growing children's bone strength which is very important for them to take through the rest of their life. So talking about diabetes, both in type 1 and type 2 diabetes, the architecture of the bone is affected because of 2-3 things. One is the inflammation, and second thing is the body habitus. Type 1 diabetes usually will be very lean, adipose tissue will be very less, and that also because the adipose tissue protects the bone, it gives a strength to the bone. And in type 2 disease, we have diabetes, we have high inflammatory markers. So that inflammation always helps, prevents the good quality of the bone. So the architecture changes in type 2 as well as in type 1 diabetes, leading on to more problems of getting into fractures. So that's the reason, even though we address so many things, fractures are more commonly seen in uncontrolled type 1 as well as in type 2 diabetes. So diabetes के बाद thyroid problems, these are most commonly seen again by practitioners as well as by the endocrinologists. If you take thyroid, again hyperthyroidism is one condition where the thyroid function is very high in the body. Hyperthyroidism affects several organs in the body. We know that it affects the heart, it affects our nervous system, everything. It also affects the bones, because even in hyperthyroidism, people get very lean and they get a decrease in the bone strength. And they also have a decrease in the bone mineral density. So there is a high risk of fracture in patients who have an uncontrolled hyperthyroidism. The next common diseases, again in a practitioner point of view, will be neurological diseases and rheumatological diseases. Because many times we get patients coming with stroke, getting admitted, and then they get discharged, they go home, and they'll be bedridden for a longer period of time. Especially apart from stroke, we have got so many other neurological problems like Alzheimer's disease, dementia, so many other things. All these neurological conditions, again, they cause a decrease in the bone mineral density. That is, there are so many reasons. One main reason is the immobilization itself. So whenever you are immobilized for a longer period of time, we take care of so many other things, but the bone part is one thing which is affected more. And then rheumatological diseases, rheumatoid arthritis, SLE. So the steroids which are used as pointed out by Dr. Vaibhav, that has definitely a very detrimental effect on the bone. So the steroids take away the bone strength, it takes away the minerals which is formed in the bone. Not only that steroids are causing bone problems, the disease per se, the rheumatoid arthritis or SLE, all these diseases, they have a low bone strength. Then we have got another malabsorption. So nowadays, if you talk about abdominal problems like malabsorption, especially the celiac disease, or people who have bariatric surgeries. Nowadays, obesity is becoming very rampant, and so many people get into bariatric surgery for weight loss. one thing which we have to take care in case of bariatric surgery or in malabsorption is that also prevents the absorption of minerals from the gut, which is important for maintaining the bone strength. And then Cushing's disease, as pointed out, Cushing's, which is most common Cushing's that we see, is due to the usage of steroids. As told, steroids always take away the bone strength, and people who are on a chronic steroid therapy, like be it for bronchial asthma or for rheumatoid or for neurological problems, all these people, their bone strength comes down. That's why we always ask them to take adequate precaution for maintaining their bone health. So you can see multiple organs, the diseases which involving multiple organs, including diabetes, thyroid, neurological problems, rheumatological problems, and malabsorption. So abdominal problems. All these things can definitely lead on to low bone density. And all these in common diseases, what we should understand is that we should take care of the bone health also simultaneously, apart from other complications.
Thank you, sir. Thank you for that wonderful elaboration, sir. With this, again, I would be continuing with the same thing, and we are getting few interesting questions from the audience as well. And sir has, Bharat sir has already touched a few common diseases like diabetes, thyroid. Especially sir ने हमें बताया कि जो थायराइड में जो पतली होने वाला थायराइड है, जिसमें थायराइड हार्मोन की मात्रा हमारे शरीर में ज़्यादा बनती है, उसमें हमारा बोन ज़्यादा इफेक्ट होता है. और सर ने हमें बताया कि हमारी आर्थराइटिस की समस्या, कुछ और बीमारियां हैं जिसमें हमारा बोन इफेक्ट होता है. विद दैट आई वुड लाइक टू आस्क डॉक्टर पार्था सर that sir, what are other diseases like, and we are getting some interesting questions as well that audience wants to know about the effect of chronic bronchial asthma on bone, and as well as how does the bone health differ in patients of type 1 diabetes versus type 2 diabetes?
Oh, thank you. I think most of the diseases have already been covered by Dr. Bharat rather. So even if you ask me what are the other diseases that perhaps have been left, I would say hyperparathyroidism. There are some glands close to the thyroid glands which are known as parathyroids. If they are enlarged, they function more. We have some defect in the quality of bones, and that perhaps is one of the commonest cause of fracture we see in endocrine practice. So that is one important thing. And other than the steroids, I would like to focus on certain drugs which are more often used as perhaps over-the-counter drugs in India. For an example, the proton pump inhibitor, जो गैस का दवाई है ना, everyone in India takes some or one or the other of the the proton pump inhibitors or the H2 receptor blockers, the ranitidine, the pantoprazole, etc. They are also known to cause decrement in bone health. That is important. There are drugs, for an example, other than steroids, anti-estrogens, which are often used in breast cancers. They are also known to cause decreased in the bone health. Some other etiologies, even if we discuss about the disease, the age groups which we are more interested in as far as osteoporosis is concerned is postmenopausal women and in elderly male. So meaning thereby age itself is a risk factor for osteoporosis. So putting that into a different perspective, the decrement in sex hormones, be it testosterone in males or the estrogen in females, which happens in postmenopausal osteoporosis, that are also known to cause osteoporosis or decrement in bone health. So these are to be kept in mind. And can I take those questions right now?
Yes, sir. Difference in type 1 versus type 2.
So that is more of a technical question. I think it has not come from a general audience. Probably it's come from a physician or a medical background. Now, we have already discussed that there are different issues in diabetes which can interfere with the bone health. For an example, we have discussed about inflammation, which is common both in type 1 and type 2 diabetes. The important difference between type 1 and type 2 diabetes is the amount of insulin in the circulation. In type 1, there is absolute insulin deficiency. There is no insulin inside the pancreas. That's why we treat them with insulin from outsides, that insulin plays an important role for the bone health. Because of absolute insulin deficiency in type 1 diabetes, there is decrement in bone health. The other part in type 2 diabetes is, and also applicable for type 1 diabetes as well, the degree of hyperglycemia. If the blood glucose level is high, there is a formation of some unhealthy products within the body. Be it, we often test HbA1c or the glycated hemoglobin, because that's a glucose reacting to hemoglobin. Similarly, that high amount of glucose reacts with the different proteins in the bone and giving rise to some impairment in quality of bone health in type 2 diabetes. Despite having some amount of a normal or even higher insulin, the bone health in type 2 diabetes is poor because of inflammation and because of that glycations. So these are the basic difference between type 1 and type 2 diabetes as far as bone health is concerned.
थैंक यू सर. सो विद दिस मैं अपने दर्शकों को ये चीज़ सर सभी पैनलिस्ट ने हमारे जो डिस्कस किया और विभिन्न बीमारियों के बारे में बताया, तो ये चीज़ मैं समराइज करूंगा अपने दर्शकों के लिए कि अगर आपको डायबिटीज़ की समस्या है, टाइप 1 है या टाइप 2 है, दोनों में ऐसे कह लिया जाए कि दोनों में अगर आप अपनी इस बीमारी को ठीक से कंट्रोल नहीं रखेंगे तो बोन पे इफेक्ट पड़ सकता है. प्लस आपको थायराइड की समस्या है, आपको किसी आर्थराइटिस की समस्या है, लंबे समय से स्टेरॉइड ले रहे हैं, आपको कोई न्यूरोलॉजिकल प्रॉब्लम है, और एक आपको अगर कोई क्रॉनिक किडनी डिजीज की भी अगर समस्या है तो उसमें भी बोन इफेक्ट होता है. तो इन सारी, अगर आप इन किसी भी बीमारियों से अभी परेशान हैं तो आप अपने फिजिशियन, अपनी क्लिनिशियन से अपनी प्राइमरी बीमारी के बारे में डिस्कस जरूर करें और साथ साथ एक बोन हेल्थ के बारे में भी डिस्कशन जरूर करें कि हमारा बोन कैसा है और हम आगे चलते हुए अपने बोन को कैसे ठीक रख सकते हैं. विद दिस नाउ आई वुड come to Dr. Ganesh sir, and my next question is to sir. Sir, as we have given the names that yes, these diseases, they do have a bad effect on our bone health. So what is, like, we know that type 2 diabetes, hypothyroidism, these all things are now very common in our society. Around many number of people are suffering from these diseases. So these all people at risk and at having the bad bone health, and what is the mechanism behind that these patients who have these diseases, they do have a bad bone health, sir?
Thank you, Vaibhav. That's a very important question, actually. So all these people who are having all these chronic diseases are at risk of developing bad bones, definitely. तो सबको जो बीमारी है उसका कंट्रोल करना चाहिए so that they can prevent the osteoporosis or bad bones in the long run. So जैसे diabetes, as Bharat was discussing, ये इन्फ्लेमेटरी डिसीज है, उसकी वजह से जो बोन्स में असर पड़ता है. तो एक्चुअली अगर ब्रीफ में बताएं तो इट्स एक्चुअली द स्टेट ऑफ ऑस्टियोपोरोसिस और बैड बोन जो होता है जब बोन फॉर्मेशन और बोन रिजॉर्प्शन उसका तालमेल जब नहीं बनता है, जब बोन फॉर्मेशन शुड बी इक्वल टू बोन रिजॉर्प्शन, और व्हेन द बोन रिजॉर्प्शन मतलब बोन जो डिस्ट्रॉय होता है उसका प्रमाण जो बोन फॉर्मेशन से ज्यादा होता है, देन देयर विल बी बैड बोन्स और ऑस्टियोपोरोसिस. दिस इज वेरी सिंपल टर्म्स. जैसे अभी हाइपरथायरॉयडिज्म है जो आपने बताया, जो पतले होते जाते हैं, थायराइड का हार्मोन ज्यादा बनता है उसमें, तो इस बीमारी में तो बोन रिसॉर्प्शन जो है बोन फॉर्मेशन से ज्यादा हो जाता है, तो बोन डिस्ट्रक्शन जो है जो बोन फॉर्मेशन से ज्यादा होता है. तो बोन डिस्ट्रक्शन इज मेनली बाय वन टाइप ऑफ सेल कॉल्ड ऑस्टियोक्लास्ट, एंड बोन फॉर्मेशन जो है ऑस्टियोब्लास्ट से होता है. अगर ऑस्टियोक्लास्ट स्टिमुलेशन या प्रचोदन, ऑस्टियोक्लास्ट का प्रचोदन ज्यादा हो गया तो रिजॉर्प्शन और डिस्ट्रक्शन ज्यादा होगा. तो हाइपरथायरॉयडिज्म में बोन टर्नओवर ज्यादा होता है, रिजॉर्प्शन ज्यादा होता है. तो हाइपरथायरॉयडिज्म इफ इट इज अनट्रीटेड और थायराइड हार्मोन्स का प्रमाण बहुत समय में बहुत ज्यादा ही है, तो कंट्रोल नहीं है, तो द बोन्स विल बी वेरी बैड, सिवियरली ऑस्टियोपोरोटिक. सिमिलरली जस्ट नाउ आई सॉ इन चैट बॉक्स आल्सो हाइपरपैराथायरॉयडिज्म, जो कैल्शियम जो पैराथायरॉयड हार्मोन जो है वो दैट विल स्टिमुलेट द osteoclasts also when the PTH is very high. So because of that there will be excessive resorption, so there will be severe osteoporosis in hyperparathyroidism. और दूसरा एक और अभी जो हम बात कर रहे थे स्टीरॉइड्स की इनटेक, तो जो भी लोग स्टीरॉइड ले रहे हैं मे बी फॉर rheumatoid arthritis, maybe for other connective tissue disorders, maybe for some neurological diseases. So for all these diseases steroids are mandatory. Without that they cannot survive. सो इन्फ्लेमेटरी बाउल डिजीज जो है, जो भी लेते हैं, सो मोस्ट ऑफ द टाइम्स दे हैव टू टेक स्लाइटली हायर डोसेज। तो उससे क्या होता है, ये जो स्टीरॉइड्स की वजह से जो कैल्शियम का जो एब्जॉर्प्शन होता है हमारे डाइजेस्टिव सिस्टम से, वो कम हो जाता है, और एक और जो ऑस्टियोक्लास्टिक जो डिस्ट्रक्शन जो होता है वो बढ़ता है। उसकी वजह से ग्लूकोकॉर्टिकॉइड्स विल प्रोड्यूस सीवियर ऑस्टियोपोरोसिस। इसलिए सबसे मैं निवेदन करता हूँ कि जो भी आप स्टीरॉइड ले रहे हैं, तो किसी रीजन से सब आपके डॉक्टर से डिस्कस करें कि एटलीस्ट बाकी सब कुछ नहीं हो पाता है तो आइडियली दे शुड गेट द डेक्सा स्कैन टू फाइंड आउट व्हाट इज द बोन डेंसिटी। अगर नहीं हो पाता है तो एटलीस्ट टेक सम कैल्शियम एंड विटामिन डी सप्लीमेंटेशन अलॉन्ग विद दैट, सो दैट दे कैन प्रिवेंट वेरी बैड बोन्स। सिमिलरली जो बाकी जो प्रॉब्लम्स हैं, जो अभी आपने सबने डिस्कस किया, जो भी कंडीशंस, कॉमन कंडीशंस जिससे ऑस्टियोपोरोसिस हो सकता है, वो उनको सबको आइडियली अगर इमेजिंग पॉसिबिलिटी है, डेक्सा स्कैन का फैसिलिटी आपके शहर में है तो जाके डेक्सा स्कैन डेंसिटी कराएं। अगर नहीं हो पाता है तो एटलीस्ट यू डिस्कस विद द क्लिनिशियन, आप आपके क्लिनिशियन के साथ डिस्कस करें कि जो बोन रिजॉर्प्शन या बोन ऑस्टियोपोरोसिस को कैसे प्रिवेंट कर सकते हैं।
थैंक यू सर। सो ये समझना सभी के लिए जरूरी है, हमारे दर्शकों के लिए, कि सर ने हमें बताया कि हमारे शरीर में अगर बोन जितना नुकसान हो रहा है वो अगर ठीक से बन नहीं रहा है तो हमें ऑस्टियोपोरोसिस होने का रिस्क रहेगा। और इसी के साथ माय नेक्स्ट क्वेश्चन इज टू डॉक्टर सौमिक गोस्वामी सर। सर, हमारे दर्शक ये सुन रहे होंगे और जिन भी लोगों को अभी डायबिटीज होगा या क्रॉनिक किडनी डिजीज या जिनको किडनी की समस्या होगी या हाइपरथायराइडिज्म होगी, वो सभी अभी इस समय सोच सुन के परेशान हो रहे होंगे कि यार हमारा भी बोन खराब है, हमें ये बीमारी है। सो now next question is, sir, that are all these patients who have these diseases, they are at risk of having a bad bone health, sir?
तो मेरा आंसर होगा yes और no। yes क्योंकि there are some factors जो हमारे कंट्रोल के बाहर है। जैसे किसी का डिजीज का ड्यूरेशन अगर ज्यादा हुआ, बहुत दिन से डिजीज है, सालों से डिजीज है, तो 6 या फीमेल्स पोस्ट मेनोपॉजल जिसका मेनोपॉज हो गया है उसका रिस्क ज्यादा है। तो जो एज ज्यादा होना या मेनोपॉज हो जाना वो तो हम चेंज नहीं कर पाएंगे, वो सारी चीज से रिस्क बढ़ते हैं। हम क्या कर सकते हैं, हम डिजीज को अच्छा कंट्रोल कर सकते हैं। वी कैन कंट्रोल द डिजीज वेल विच विल रिड्यूस द रिस्क। लाइक डायबिटीज में गुड कंट्रोल ऑफ ब्लड शुगर, जिसको इंसुलिन जरूरत है इंसुलिन देना या दूसरा दवाई यूज करना। कुछ ऐसे ब्लड शुगर का दवाई होते हैं जिससे बोन का नुकसान भी पहुंच सकता है, तो उसको अवॉइड करना, तो वैसे हम ठीक रख सकते हैं। थायराइड में भी थायराइड लेवल्स को हम जितना नॉर्मल के पास रख सके, दैट विल प्रिजर्व गुड बोन हेल्थ। एंड उसके लिए यू नीड टू गो टू योर डॉक्टर, डू द टेस्ट एंड टेक मेडिसिन एज एडवाइज्ड। किडनी डिजीज में भी हमारा डाइट अगर ठीक रहा तो फॉस्फेट लेवल हमको मॉनिटर करना होता है, उसको ठीक रखना होता है, विटामिन डी लेवल ठीक रखना होता है। ये कर सके तो किडनी लेवल में भी बोन हेल्थ अच्छा रहता है। जब स्टेरॉइड का जरूरत हो, वी से यूज द लोएस्ट डोज फॉर द स्मॉलेस्ट पॉसिबल टाइम। जितना कम डोज हो सके मिनिमम, जितना जल्दी हम बंद कर सके उतना अच्छा है। जिनको बहुत दिन तक स्टेरॉइड लेना होता है उनको हम बोलते हैं कि उनका कैल्शियम ठीक रखना चाहिए, विटामिन डी ठीक रखना चाहिए। उनको कभी कभी हम ग्रुप दवाई देते हैं, बिसफॉस्फोनेट्स बोलते हैं, जो बोन का डिस्ट्रक्शन बंद रखता है। तो वो अगर हम ठीक से कर सके तो जो जिसको स्टेरॉइड्स मिल रहा है लॉन्ग टर्म, उसका भी बोन हेल्थ हम प्रिजर्व कर सकते हैं। तो डिजीज को अच्छा कंट्रोल करना, बीइंग इन टच विथ योर फिजिशियन, ये सारे चीज, ये सब डिजीज में हमारा बोन हेल्थ प्रिजर्व करने में हेल्प करता है।
Thank you, sir. So this is very important message from sir that yes, people are at risk, those who are suffering from these diseases. But if you take care of your primary disease, if you keep good control of your sugars, if you keep good control of your kidney disease, keep a healthy lifestyle as well as diet, then there are less chances that yes, your bone health will be affected. So yes, now moving ahead, I'll be taking few questions which are being put by our audience, and with that I put the question to Dr. Bharat sir. There are few questions coming regarding the pediatrics बच्चों के लिए sir. So the question is, sir, what are the pediatric diseases which can affect bone health leading to osteoporosis, and when do we recommend screening for osteoporosis in pediatric age group, sir?
Yeah, actually, that's a good question because as I discussed in my previous thing also, type 1 diabetes, what we were discussing. So, children with type 1 diabetes, this way you can have a low bone mineral density. Mainly children who are having any kind of a chronic disease, especially cerebral palsy or Duchenne's muscular dystrophy. Some children having a chronic kidney disease due to genetic reasons, and children who are having cystic fibrosis, celiac disease. These are some of the chronic diseases which are seen in children, which can cause a low bone mineral density. So, children, the recommendation for screening in children is if a child has a specific disease like unko cerebral palsy, who is having a long-term severe scoliosis, or who is having a Duchenne's muscular dystrophy, or if the patient is having a juvenile rheumatoid arthritis can happen in children also. So if the child has a juvenile rheumatoid arthritis for more than 5-6 years, or if a child is having a cystic fibrosis, and if the child is having an age of more than 8 years. So these are some of the, and if the child is also on a prolonged steroid therapy, because most of the diseases like juvenile rheumatoid arthritis or other chronic inflammatory diseases, autoimmune diseases will require steroid therapy in children, especially children who are treated for pediatric cancers. Many children are treated for pediatric cancers, and nowadays with good cancer treatment, children, they survive very well. They come to the adult age group and all. Our another common disease that we see in children is, as Dr. Partha Pratim has discussed, is children with low gonadal function, especially in the adolescent age group. If a child has a low sex hormone functions like low testosterone or low estrogen in a female, they can also have low bone mineral density. So if a child has a specific disease and if the child is on a prolonged treatment, then definitely there is an indication for doing DEXA scan in the child and treat the child accordingly with the treatment for osteoporosis.
थैंक यू सर. सो ये दर्शकों को मैं बताना चाहूँगा, सर ने हमें बताई सारी चीज़ें, और इसमें ये कि आपका बच्चा अगर किसी लंबी बीमारी से परेशान है, लंबी बीमारी का कोई ट्रीटमेंट ले रहा है, जैसे सर ने हमें बताया कोई किडनी की समस्या हो और या कोई कैंसर का ट्रीटमेंट ले रहा हो, तो ये बच्चे कुछ जो ट्रीटमेंट चलता है, स्टेरॉइड्स चल रहा है या कुछ और दवाएं जिनको रिस्क हो सकता है कि बोन हेल्थ इफेक्ट हो सकता है, तो इसके लिए आप अपने क्लिनिशियन से डिस्कस करें और इसके बारे में जरूर समझें कि बोन हेल्थ पे क्या इफेक्ट है. Now, moving ahead, our audience must be thinking that yes, we are only telling about that yes, these diseases can affect the bone, and these are the things that can have bad effect, and which are the patient population who can have a bad effect, who are suffering from these diseases. So now moving ahead to that, how we can prevent and how we can treat and how we can help our patients in having a good bone health. So now my next question is to Dr. Partha sir. Sir, that I would like you to recommend what measures these patients should be taking to prevent fracture or to have a bad bone health, sir.
Before that, I could say a very interesting question. What are the symptoms of osteoporosis? Now, let me tell you that osteoporosis is a completely asymptomatic disease. So you do not know whether your bones are healthy or not until and unless you sustain a fracture. That is the most dreaded complication of osteoporosis, and before that you are unlikely to get any symptoms as far as osteoporosis is concerned. The point is, once someone sustains a fracture, the risk of second fracture becomes high, number one, and if there is a hip fracture, that might increase the risk of death as well. So the whole purpose of this group discussion or this public awareness is to prevent fracture. That is the motto of treating osteoporosis. Now, coming back to your question, Dr. Shomik has already discussed, there are things which you cannot modify. You cannot modify your age, you cannot modify your sex. So the main purpose is to prevent osteoporosis or to prevent fracture, and for that the most important is, number one, you have to have a very good lifestyle that consists of a balanced diet and a regular exercise, which I shall be discussing. I shall elaborate a bit on exercise and diet as well. Now, as far as diet is concerned, the two most important things that need to be kept in mind is that number one, adequate calcium intake, and number two, adequate vitamin D intake, right? Now, because of our lifestyle, almost all of us, even the doctors, even perhaps the panel you have today, I'm sure they are all on a vitamin D supplement because they are all vitamin deficient. So this can be generalized in India, even in those with adequate exposure of sun. Because of the dark skin we have, majority of us are vitamin D deficient. So you have to supplement vitamin D from outside. Usually we prescribe a dose of 1000 unit to 2000 unit of vitamin D daily, and that has to be taken as medicines, right? And about calcium, for an example, there are age specific cutoff of recommended daily calcium intake. For an example, in adults, you have to have 1000 milligram of elemental calcium per day for adults. For adult women after menopause, that amount is around 1200 milligrams. So meaning thereby you have to have 1000 to 1200 milligrams of calcium per day, and preferably that should come from a diet, not from a supplement. Now, in India, we have somewhat a diet which are somewhat deficient in calcium. So we recommend a 500 milligram of calcium tablet per day as supplement, if not adequately provided from the diet, for everyone, as far as the prevention of bone health is as far as bone health is concerned. Now, once again, if you look at the calcium rich diet, the most important thing that is rich in calcium is milk. Cow milk about 100 ml contains about 120 milligrams of calcium. Similarly, buffalo milk contains about 100 ml contains about 180 milligrams of calcium. So if you love milk, then it's fine. Take at least 300 ml or 200 ml of milk per day. But having said that, a majority of our populations, they often suffer from lactose intolerance. They cannot tolerate milk. So once again, we have to supplement calcium from outside if they cannot tolerate milk. So calcium is vitamin D is important. The next two important thing is avoidance of smoking, a complete cessation of smoking for a number of reasons, including bone health. You have to limit your alcohol intake as far as possible, not more than 2 units, that is more than 20 grams per day. Regular exercise, weight bearing exercise that includes walking, jogging, climbing stairs, some amount of resistance exercise, and some amount of balancing exercise. These are probably the best way as far as maintenance of a good bone health is concerned for the general public.
Thank you, sir. Thank you for this elaboration, sir. With extension of that, sir, sir has already mentioned few food like milk. Sir has mentioned, as well as sir has emphasized upon that we have to take vitamin D from outside because it is difficult to get it from sunlight completely. Sir, with this, I would like to. The next question is to Dr. Ganesh, sir. Sir, as we know that whenever we are discussing any disease with our patient, often the next question comes is, sir, इसमें खाएंगे क्या? Whenever we are discussing about thyroid, diabetes, any, कि sir इस बीमारी में क्या खाना है, क्या नहीं खाना है. So I would like to ask you, sir, few common food which you would recommend that these patients should take it, which would keep bones healthy, sir.
Yeah. So thank you, Vaibhav. I agree with the Parthapratim, most of the issue, actually whatever he has told. तो अभी कैल्शियम रिच फूड जो है, जो अभी अपना डायरी प्रोडक्ट्स है, डायरी प्रोडक्ट्स एक गिलास मिल्क अगर 250 ml का एक गिलास दूध में शायद 200 ग्राम्स तक कैल्शियम मिल सकता है. तो अगर एज पार्था वाज टेलिंग, so we require 1000 to 1200 milligram of calcium per day. So to fulfill that, probably a person has to take 5 to 6 cups of milk per day, which is not possible. तो इतना खाएंगे तो कोलेस्ट्रॉल भी बढ़ेगा, बाकी सब कुछ प्रॉब्लम हो सकता है. सो लैक्टोज इंटॉलरेंस की तो है ही, उसके साथ में दूसरे प्रॉब्लम भी हो सकता है, इसलिए वो इट्स प्रैक्टिकल नहीं है. तो 5 to 6 cups ऑफ मिल्क इज नॉट पॉसिबल. तो दूसरा जो है अपना फिश, जो फिश ईटर्स हैं, सार्डिन्स में थोड़ा कैल्शियम ज़्यादा रहता है. So sardines is a good source of calcium. बाकी otherwise vegetarian diet में calcium is very less actually. Some of the green leaf vegetables contain a bit, but it's very minimum quantity. So the vegetarians के लिए calcium they will have to take as medication only. It is not possible for them to get enough calcium in the diet. और बाकी इसके अलावा जो है वह कैल्शियम विटामिन डी के अलावा पोटेशियम भी इट्स इम्पोर्टेंट फॉर बोन हेल्थ बिकॉज द पोटेशियम अगर पोटेशियम रिच फूड लेंगे तो जो एसिडिक एनवायरनमेंट जो है वो कम होता है so that can prevent the osteoporosis to some extent. So some fresh fruits which are good in potassium, rich in potassium, may be useful for bone health. Or one more thing is magnesium. So one reason why PPAs produce osteoporosis is because of hypomagnesemia. तो मैग्नीशियम रिच फूड जो है जो हमारा फूड में मिलता है नट्स सीड्स वगैरह उससे भी थोड़ा बोन हेल्थ के लिए भी बेटर रहेगा. सो प्रोबेबली वट एवर इन ब्रीफ the diet for osteoporosis or preventing bone health has बहुत minimum role है. It's not like diabetes. Diabetes is related only to diet actually. So if you control your diet well, you will not need medication in majority. So but it's not osteoporosis or thyroid problems जो है, it is not diet related disease alone. So इसमें diet के अलावा exercise भी important है और medications also have a major role. कैल्शियम सप्लीमेंटेशन, विटामिन डी सप्लीमेंटेशन, उसका भी बहुत इंपॉर्टेंस है ऑस्टियोपोरोसिस और बोन हेल्थ में.
Thank you, sir. So we are getting few questions from the audience as well, sir. And sir, both our panelists have already emphasized upon diet and few points about exercise. Sir, I'd be taking an audience question, and the question is to Dr. Swamik, sir. Sir, the question is how to recognize early phase of osteoporosis. So is there any way that we can recognize the early phase of osteoporosis?
So as Dr. Partho has already said, there are no symptoms. तो बाहर से कुछ पता नहीं चलेगा पेशेंट को. तो जैसे बहुत सारे दूसरे बीमारी भी होते हैं, थायराइड का बीमारी, डायबिटीज का बीमारी, बहुत सारे पेशेंट में पहले से कुछ पता नहीं चलता है. सो रूटीन स्क्रीनिंग इज द ओनली मेथड. तो जो एल्डरली है, जो पोस्ट मेनोपॉजल वुमेन है, पर्टिकुलरली जिसका 10 साल हो गया है मेनोपॉज से, उसको हम बोलते हैं कि आप टेस्ट करवाइए, बोन मिनरल डेंसिटी डेक्सा जो टेस्ट होता है, टेस्ट करवाइए टू पिक अप अर्ली ऑस्टियोपोरोसिस. एंड ऑफ कोर्स हम बोलते हैं प्रिवेंशन इज बेटर देन क्योर. सो हेल्दी डाइट, हेल्दी एक्सरसाइज, उससे प्रिवेंट कर सकते हैं. पिकअप सिर्फ टेस्ट करके कर सकते हैं, अदरवाइज वो सिम्टम्स कुछ पता नहीं चलेगा.
Thank you, sir. Thank you, sir. So now my next question is regarding the exercise. We'll be discussing few points about exercise. And with that, sir, with the question is to Bharat, sir. Sir, if exercise, as has been emphasized by previous panelists, that exercise is needed to keep our bone healthy. So what are the types of exercise which our patients can do which would keep our bones healthy, sir?
See, exercise, the purpose of exercise mainly is the main important thing is you should have a good flexibility. So second thing, your muscles also should be strong because bones are supported by muscles. A strong muscle only can support a stronger bone. And third important thing is your bones also should gain strength. So the purpose of exercise is three things. One is you should have a good flexibility, agility, you should have a good strong muscles, and you should have a good and a strong bone. So for achieving these three things, you need a structured exercise program. Many people tell, like, I do all the household activities. Oh, why should I do exercise? That is not actually considered as exercise. You should take your time in a particular time of the day and do a structured exercise program to achieve all these three things. To have a flexibility, to have a good strong muscle as well as bone. So if you talk about exercise per se, you can divide it into three groups. One is weight bearing exercise. So weight bearing exercise, mainly you do exercise like jogging, very brisk walking, or you do a kind of climbing stairs, or you do a racket, using rackets. You can use badminton or shuttle, or you can play a volleyball or basketball. See, these are some of the low to high impact weight bearing exercises. which will help you to be more, it will help you to burn your calories, as well as it will help to improve strength for your bones also. Weight bearing exercise should always be combined with the resistance exercise. So resistance exercise is mainly to strengthen your muscles. So in resistance exercise, either you can use a free weights we can use it, or you can also use a resistant bands, you can use, or you can use some push-ups, simple push-ups, or some of the resistance kind of exercises. So a weight bearing exercise at least 20 to 30 minutes a day, a low impact or a high impact. So which kind of a weight bearing exercise you need to do, you have to consult your doctor, because many people will have spine issues, many people would have sustained a fracture already. So before starting any kind of an exercise, go to the doctor and find out whether you are fit to do this exercise, because you may have a heart problem, you may have another problem which may prevent you from doing an exercise. So say a particular form of exercise. So ask your doctor whether I am fit to do this exercise, and then start that training. So don't do it just by someone has told you. So that is one thing. So weight bearing exercise, depending on whether you are good, fit enough, you can go for a low to high impact weight bearing exercise, at least 20 to 30 minutes. And resistance exercises, at least you need to do 3 or 4 sets of repetition around 10 to 12 times, either with simple weights or with resistant bands or with the push-ups. The third is flexibility exercises. For flexibility, we can add yoga, or we can add some of the other flexible like Zumba or dances. These kind of things can improve the flexibility. Even Tai Chi, some of the Chinese exercise kind of things, they can improve the flexibility. So you should combine all these things: flexibility exercise, weight bearing, and resistance exercise in a structured way to achieve a good bone health.
Thank you, sir. Thank you for that wonderful elaboration, sir. And moving ahead, sir, as in other sessions, we do bust a myth in the end. And to bust this myth, my next question, and this is the last question of the session, sir. Generally, हमारी societies में लोगों को जो 60 साल 65 साल की उम्र के लोग ज़्यादा हो जाते हैं, उनको एक myth है कि उनको डंबल्स नहीं उठाने चाहिए, उनको वजन वाले एक्सरसाइज नहीं करनी चाहिए. And to bust this myth, the question is to Dr. Partha, sir. Sir, वुड यू रिकमेंड रेजिस्टेंस एक्सरसाइज? क्या आप हमारे जो बुजुर्ग लोग हैं, जो 65-60 साल के लोग हैं, उनको आप अपनी मसल्स की एक्सरसाइज करने की, मसल्स मजबूत करने के लिए कहेंगे सर, जिससे उनका बोन स्ट्रांग रहे? सो इफ यस सर, एंड हाउ डू दे हैव टू गो अबाउट इट सर?
It's a very difficult question to answer. So I would suggest do it, but do it with caution, because as already told by Dr. Bharat, there are some roles of resistance exercise to improve the muscle strength. Once your muscles are strong, and as discussed by Dr. Shomik earlier, the fine example of a snake. So if your muscles are strong, you are less likely to, the risk of fall is much less once the muscles are strong. So one of the way of preventing fracture is to prevent fall, and you can prevent fall once your muscles are strong. So for that strengthening of muscle, you need to have some amount of resistance exercise, but once again, that has to be done with caution, because in the elderly, the bones are maybe soft enough to, they may sustain fracture during a bout of resistance exercise. So do it in a proper way. Start with a low weight, gradually increase the dose, increase the weight, but do it in a proper way. So preferably with the help of a trainer or something like that, if you have that facility. Otherwise, I would suggest, particularly for the elderly, more of a weight bearing exercise than a resistance exercise. Resistance exercise needs to be done with caution, with proper caution.
Thank you, sir. सो विद दिस, दर्शकों को समझना जरूरी है कि एक्सरसाइज जरूर करें जिसमें आपका बोन हेल्दी रहेगा, और एक्सरसाइज डिफरेंट तरह की एक्सरसाइज करेंगे तो वो आपके लिए मोनोटोनस भी नहीं होगा. आप किसी दिन रेजिस्टेंस ट्रेनिंग करें, किसी दिन एरोबिक ट्रेनिंग करें, किसी दिन फ्लेक्सिबिलिटी की ट्रेनिंग करें. सो दैट विल गो अ लॉन्ग वे इन कीपिंग योर बोन हेल्दी, सर. And as I said in the beginning, this is the month of October, where the Endocrine Society of India was raising awareness regarding the bone health, especially the osteoporosis. And we are coming to the end of this month, and this is the last session regarding the bone health. So with this, I would ask my respected panelists to give a take-home message for our audience regarding bone health and regarding osteoporosis. And I would begin with Dr. Ganesh sir. Sir, a take-home message for our audience, sir.
हाँ, मैं सभी दर्शकों से विज्ञापन करूंगा कि सारे जो हैं जो अपने बच्चों को खेलने दें एटलीस्ट 1 आवर पर डे, क्योंकि आप सब बिजी हैं, ट्यूशन में, अपने स्कूल में बिजी हैं, तो उनको एटलीस्ट 1 आवर फिजिकल एक्टिविटी में एंगेज करें। और खाने में भी थोड़ा हेल्दी फूड विद द मिक्स ऑफ फ्रूट्स, वेजिटेबल्स एंड fish, this kind of food, or less of junk foods and fast foods, so that they can develop good bones and they can prevent osteoporosis in the long run.
Thank you, sir. Swamik sir, take home message for our audience regarding bone health, sir.
हाँ, डॉक्टर गणेश बच्चे का बात किया, मैं बुजुर्ग का बात करता हूँ। तो इफ योर एज इज अबव 60 years, irrespective of whether you are a male or female, you ask your physician whether you need to go for a bone mineral density testing, DEXA, to pick up early osteoporosis.
Thank you, sir. Bharat sir, a take home message for our audience, sir.
Yeah. So again, for menopausal women, because menopausal women, they should take care of their bone health well, and osteoporosis is very commonly seen in menopausal women. So if you are going through the menopause phase after 4 or 5 years, your bone strength will come down. So definitely ask your doctor, your gynecologist, or your general physician, whoever you are consulting, to at least screen for an osteoporosis and take adequate precaution at the early itself, because you can prevent a fracture. You can prevent a fracture definitely if you are able to take care of the bone health.
Thank you, sir. Partha sir, take home message for our audience, sir.
So my colleagues have already discussed about issues in children and in elderly and in postmenopausal women. So I am left with adult males and females. So once again, adequate calcium, adequate vitamin D, no to smoking, limit alcohol, exercise. That's it for all adults.
थैंक यू सर, थैंक यू आवर रिस्पेक्टेड पैनलिस्ट। सो इन सभी बातों के साथ मैं अपने दर्शकों को, हम आज जो चीज़ें डिस्कस किए, इन चीज़ों को मैं जस्ट समराइज करके बताना चाहूँगा कि आपको किसी भी तरह की बीमारी है, अगर आपको डायबिटीज़ है, किसी किडनी की समस्या है, आप लंबे समय से किसी तरह की कोई स्टेरॉइड्स की दवा ले रहे हैं, आर्थराइटिस की लंबे समय से समस्या है, तो इन सारी बीमारियों में एक खतरा जरूर बना रहता है कि आपकी हड्डियों पर उन बीमारियों का असर पड़ सकता है। और उन बीमारियों के हड्डियों पर असर पड़ने का सबसे बड़ा खतरा ये रहता है, जैसा कि स्वामिक सर ने हमें बताया, कि बिना कुछ बताए ये फ्रैक्चर हो सकता है। तो बिना किसी सिग्नल के, बिना किसी सिम्टम के अगर हड्डियां हमारी कमजोर हैं तो हमें फ्रैक्चर हो सकता है और उसके बाद आगे और चलते हुए प्रॉब्लम हो सकती है। तो इन सारी चीज़ों के लिए पहली चीज़, हमें अपनी जो बीमारी है उसका ध्यान रखना है, उसके लिए नियमित रूप पर ट्रीटमेंट लेना है, समय से उसका इलाज कराना है। और जैसा कि एक और चीज़ हमारे सारे एक्सपर्ट्स ने इस पे एम्फेसाइज किया कि समय समय पे इन बीमारियों से अगर आप ग्रसित हैं, इन बीमारियों से अगर आप परेशान हैं, तो अपनी बोन हेल्थ के बारे में अपनी क्लिनिशियन से जरूर डिस्कस करें और अपनी लाइफस्टाइल, डाइट और एक्सरसाइज को जरूर करते रहें, जो कि आपकी सिर्फ बोन हेल्थ को नहीं, आपकी ओवरऑल हेल्थ को जरूर ही स्वस्थ बनाएगा। इन सभी बातों के साथ आज हम अपना कार्यक्रम बंद करना चाहेंगे। And with this, I would like to thank my respected panelists for giving the time. And with this, I would like to just announce that next month, Endocrine Society of India is celebrating the Diabetes Month, in which we'll be focusing especially on the diabetes, and we'll be bringing up a lot of awareness programs for public with respect to diabetes and management of diabetes. So इन सभी बातों के साथ मैं सभी का धन्यवाद करना चाहूँगा जो कि हमारे साथ जुड़े। Thank you very much. Thank you.
शुक्रिया।